Okay, here we go. Advaita Acharya Prabhu, please accept my humble obeisances. All glories to Srila Prabhupada.
Please accept my Dandava Pranam, Gopal Bhatta Prabhuji. Very nice to see you face to face. After
Yes,
2-3 times we talked to each other on the phone, and
yes,
I'm very
we
happy
uh,
to
we
meet you.
spoke about Gopal Krishna Maharaj, your Guru
Correct.
Maharaj.
Yes. And so, very thank you very much for allowing me to participate on this program that you are running for last few years. I think 2006, believe.
Yes,
So,
and then of course when the COVID disease came, then we had a concentrated effort to educate devotees on this terrible disease. Of course, one of the reasons that we've been wanting to speak with you is because you are a medical professional, a doctor. So let's start with letting the devotees who are watching, and I should also say that the video will go viral and be watched by thousands of devotees. So maybe you could just begin by telling us something of your devotional life, when you joined Krishna consciousness, and like that.
so let me first of all offer my obeisances to His Divine Grace Srila Prabhupada. Because of His mercy, I'm here. Namam Vishnu Padaya Krishna Prestaya Bhutale Srimate Bhaktivedanta Swamiti Namne Namaste Saraswati Deve Gaurvani Pracharine Nirvishesha Shunyavadi Paschatya Destarine. Please also offer to my Guru Maharaj, His Holiness Gopal Krishna Maharaj. Namam Vishnu Padaya Krishna Prestaya Bhutale Srimate Gopal Krishna Goswamiti Namne Prabhupadasya Sahityam Ya Prakash Vitiriyaj Pracharam Kritvam Sadhu Bhagavad Padayate Namah. Vancha kalpatarubhyascha kripa sindhubhya eva cha patitanam pavanebhyo vaishnavebhyo namo namah. Please accept my Dandava Pranam to all. And let me just begin with my spiritual life first, and then I'll go with my medical life. So the history goes back about 35, 37 years ago.
Mm.
1982, first time my father inspired me to go to Mayapur.
Oh,
At that time, I was practicing medicine in a local town in a small clinic. And so my father says, well, there is a nice town, city, you call, and it's close to Calcutta. And if you can come to Mayapur, it's very nice. And I said, I never heard about Mayapur, but I heard about Calcutta. And Havra Bridge was very famous. So I thought, let me just go to Calcutta and then on the way to Mayapur. So we took local train from Ahmedabad, Gujarat. It takes
mm.
2.5 days to reach to Calcutta.
Mhm.
And then it was at like 10 o'clock in the morning. Then we took the bus, local bus, to go to Mayapur. So we reached around 6 o'clock. And when I enter into the premises of that Mayapur Dham, my my heart was completely changed,
Oh.
because that time that most of the devotees that in Mayapur in 1982, they all young devotees, all white bodies, beautifully decorated their bodies, and Prabhupada's kirtan was going on smoothly around 6 o'clock on the speakers everywhere.
Mm.
And I entered to so we are all tired because 2 days no shower and tired. But when I entered into the gate, it transformed completely. I forgot everything.
Mhm.
And so that inspired me. And then next year, my father says, let's go again. And before that, I go to Mayapur second time. Krishna's arrangement, His Holiness Gopal Krishna Maharaj came to my hometown.
Mm.
And my hometown is a Dakor, is a Ranchor's famous temple after Dwarka.
Ah,
So
okay.
Gopal Krishna Maharaj came to visit. I do not know what would the reason, but anyway, he came to our home, and it was Ekadashi.
Oh.
And then I did not know that he's a guru that time. But anyway, I went to Mayapur second time in '83. Then my father actually forced me to take initiation.
Mm.
He told me that you should, and I said, well, I'm going to America in few months, and I don't know to take initiation. I don't know to take all this bondage and restrictions and rules and regulations. I used to drink coffee. And he said, I heard from my father that you have to give up all coffee, teas, this, that. So I was reluctant. I had desire but reluctant. And finally, my father requested Gopal Bhatta Maharaj that can you please initiate my son. So reluctantly, I accepted him as my guru.
Mm.
And because of his mercy and Prabhupada's mercy, my spiritual life started in a different.
Mm.
And so because of that, I am here today. So
This is a wonderful story.
yeah, and I can tell you a few things about my father. My father, he passed away in 1993 when I started practicing my business here. So 93, he passed away, but 1979 he came from India to America just to visit. My father was by profession school teacher. My elder brother, his name is Sham Krishna Das, he's a doctor too. So he was practicing here in Navy. And my father came on a visitor visa. And he was living close to San Diego in called 29 Palm.
29 Palms, that's right.
That's
out in the desert.
And my brother was in Navy, doctor.
Ah.
So one day, two young devotees from San Diego temple visited my father's home area. They were doing some book distribution or prachar, whatever, preaching work. So they gave a little card to my father. Said, there is a temple, Hindu temple, you can come and visit. So he told my brother, says, can you take me to temple? Because they're getting bored here. So anyway, once they visited temple, in a less than couple of weeks, he joined ISKCON.
Oh.
He took initiation from Rameshwar Maharaj that time.
Uh-huh.
And then in 1 year, after taking initiations, now my father has bad habits. He was drinking, he was smoking, but in a 1 day he stopped everything. And he stayed in temple. That time he was like 52, 55 years of age. And all the devotees in the San Diego temple, they're all young, 20, 25.
Right.
Badrinarayan Prabhu was the president, Maharaj now. And so actually he inspired him also. And after 1 year, he come back from USA to India. And that's where he started. And because of his mercy, almost 100 devotees came in our family members.
Really?
Almost everybody is now inspired or initiated.
Wow.
So credit goes to my father, Nam Kirtan Das, Gopal Krishna Maharaj, and of course, Srila Prabhupada. Srila Prabhupada mercy.
Wonderful story. Just great.
So this is my beginning of a spiritual journey. And when I came to America, the Gopal Krishna Maharaj also told me that you don't act and behave like a typical Gujarati. You're coming to America not just to make money, but your goal should be different. So I tried to follow his instructions.
Wonderful story. So, are you married?
Yes.
Tell us about your good wife.
So my marriage was arranged marriage. And that is another credit goes to my father. He selected my wife. And we are married for more than 37 years now. Close to that. Married in 72. And she's housewife. And she's very dedicated and loving wife. She wants to make sure that my care is the most important in her life. That's her quality.
And what is her good name?
Her name is Naika Priya Devi Dasi.
Naika Priya Devi Dasi.
So she's also initiated by Gopal Krishna Maharaj. I have two daughters.
What are their names?
One is Hetal.
Okay.
And she lives in the Baltimore area. And she's a social service therapist. And she's inclined to take initiations, hopefully this year, maybe next year. This year, Gopal Krishna Maharaj did not come to America, so I think she missed it. And my second daughter, her name is Chintamani. And she's working with me in my office as my manager.
Oh, at the hospital that you are working in?
Yeah, I have my own office clinic. And I have three grandsons. One from Hetal is Keshav, and one from Chintamani. There are two Aditya and Nimai.
Mm.
So this is my small family. Of course, my extended family is my brother, my younger brother. He also lives with me in the house. He also initiated. His wife initiated. My elder brother, his wife, my younger, all families are initiated by Gopal Krishna Maharaj.
That's so wonderful. Tell us about your professional life.
So then I came. So before I came to America, 5 years, 4 to 5 years, I practiced in India, and India practice was very, very, very primitive kind of practices. I'm not sure I did good practice or not when I'm looking back now.
Mm.
But that time I felt I did great job. But because the India at that time, I'm talking about 30 or 35 years back, there is not much development in the medical field. We don't have any blood tests, we don't have any X-rays, nothing in a remote small village, because town is very small, and all patients come from villages. They hardly actually when I go to house calls, they give me some eggplants, they give me some vegetables. That's all they pay. And I was there waiting to get America visa. So I said, well, let me just do some service, because I'm not going to do more service to the when I come to America. So I did almost free service to a lot of my patients, and people appreciated it, and I loved it. So 1983, I came to USA on visitors visa on a green card, and I struggled for 10 years from 83 to 93, because that time difficulty to get residency. And if you don't get residency, you cannot have license, you cannot practice.
Right.
Even though I was practicing full-fledged in India. Anyway, after 6 to 8 years of struggle, finally I got residency in Bethlehem, Eastern Pennsylvania. That's why I finished my internal medicines for 3 years. And immediately I came back to same local town that I first landed in America, in Waldrop, La Plata area, where my brother is practicing as a general surgeon for last 35 years plus.
So your brother is also a doctor.
He's a physician,
surgeon.
he's a general surgeon, and he's also working in the same hospital. So he's my role model as far as the medical profession is concerned. So he supported me in the first 10 years with me, my wife, my daughters, because then I don't have to worry about home and food and this and that. So I struggled in the beginning. Like my job was $3 per hour.
Oh, terrible.
I work in Washington Post, flipping the papers. But then by Krishna's blessing, Guru Maharaj's blessing, Prabhupada's blessing, everything turned around. And I got residency and I started practicing, and I have my fairly good practice now. And in the beginning, I struggled. One time I was depressed. I said, let me go back to India. This is not for me. But I think because of the spiritual understanding and all this knowledge that we had, that we have to struggle. The struggle is always there.
So my understanding is that first as a doctor, and then you actually started to make a contribution to the hospital that you're a part of, and you work your way up into being a board of director. Tell us about that.
So in the beginning, as I said, when I came to start at 93 practice, my brother actually inspired me. He says, you should take some leadership role in the hospital. So there are small committees. So he inspired me to join committee. And after that, he says, now you can become department chair. So I took that responsibility. And then finally, I became chief of staff of the hospital. And then finally, I finished all these things. And my brother followed the same steps. So I followed him, exactly his steps. He also chief of staff, and he also board of director for 9 years. So then I just followed him, and now I'm serving as a board of director in the hospital. This hospital is connected to University of Maryland, Baltimore.
Oh, okay. So it's part of the university system.
Yes. So we are part of UMMS.
Which places the hospital in a special place, because teaching hospitals are generally some of the highest quality hospitals.
Yes. So we do not have teaching program, but I do some teaching program in my office. I train some physician assistants, nurse practitioners. So this is like service to the community. So that's I do.
Very good.
And go ahead.
So right now we have a pandemic going on, and 32 million people have caught this disease, and Of course, that means that so many more than that have caught the disease because you cannot count them all. And it seems like it's pretty nasty disease. So tell us about COVID and what you're thinking about all of this.
So I'm thinking about COVID. Actually, in the February, I did not even pay attention to COVID myself, because in the beginning people thought about this is called China virus and it's coming from China and it's a typical virus, it will come and go, disappears, not a big deal about it. And the number was, we start watching news and the number is going up and up. Then realized that it's spreading to the Europe and then it's coming to, so until it comes to New York, we did not take seriously actually. Even after coming to New York, a lot of people did not take seriously. And unfortunately today people not taking seriously also.
Yeah, that's right.
This is the biggest what you call problem, that we all not really paying attention. Now coronavirus, I just go through some overview about the virus disease. So this coronavirus is existing according to the medical business and medical field and research laboratory for the last 60 years. But those virus is causing common cold. It comes and people get sick for a few days or week and then disappear and back to normal. So the same coronavirus is transforming to the different viruses now. So the basic structure is the same. It's like when I give analogy of like a Toyota company, the motor cars, and they start with the small car and then we go to deluxe and more and advanced, and every year there's new technology comes and it's completely transformed from original car to new car now. Same thing, this coronavirus transforming and strain and RNA, it changes continuously. So that's where then that's called Middle East, what you call respiratory syndrome called MERS. That episode came at that time, almost 2,000 people were sick in Middle East, and out 800 people were died. And the same virus transformed more to now called severe acute respiratory syndrome called SARS. That's a very common name. And they always put COVID behind, corona behind. So that virus also came in epidemic. At that time, about 8,000 people got sick and 800 people died. So it was not that bad compared to that. And that's gone now, sort of. It's not any pandemic effect. And it's now controlled, only in laboratory places that you can find, research lab, you can find the viruses. But then in end of the 2019, the same virus becomes like a COVID novel virus. It's completely brand new. It's completely reformed. And it has very high infectivity rate. And this virus also now is completely new. So medical sciences, businesses, research, still working on that and to understand the virus. That's why we have not much what you call controlling this virus, because still is more and more evolutions. Otherwise, even 5 years old, my grandson knows what coronavirus is now. But most of the people, they're not really understanding properly. So there's no treatment actually at this point. But this virus, once it starts, then the transmission is through the airborne. And it goes through the droplet or floating the particles in the air. And they have some status data that, well, it can spread in air, it lasts for 1 hour at least, survival. Also to the surfaces, it can survive longer. So they have some what you call different kind of, now how it starts with the simple respiratory problems. So people start talking, sneezing, coughing, singing.
Yes,
These
singing
are
in
the
kirtan.
common ways the virus can spread. And when you cough and sneeze, sometimes it can go up to 24 feet. And that's why they say that 6 meter or 24 distance should be there if it's a closed space. Open space is fine, but closed space, the minimum we have to have that much space actually. But we are not able to keep those distances, and that's spreading more and more and more. Now, once you get infections, it's the incubation period is about five days average. And latest information is that 1 day before the symptom starts, That's the time this most highly infectivity period is the 1 day
Oh, before you even have
before.
symptoms, you can infect
Yeah,
people
suppose if
at
I
the
get
highest level.
suppose if I get coughing now today, if I have some symptoms, that means yesterday I was most infectious person to spread it.
Mm,
And that's why it's very, very important to this virus to really prevent it.
mm,
And this virus, now if you look at it, the last, if you study, there's so many studies now, so much literatures in the world now. Any Google, you put any information, you can find out what so much information about coronavirus. So people does not need to really now know too much about virus. It's there. It's going to stay there. It's not going to disappear so quickly. Even the vaccines comes, not sure about it, because a
mm.
lot of people not even ready to take vaccines. They're worried about taking vaccines now as well. It could be negative side effects. People get sick from vaccine too, just like in flu vaccines. In America, 2017, I think almost 48 million people get infections from the flu vaccines.
Mm,
There are 80,000 people died in 17, 18.
mm, mm,
So it's a mortality, but we don't pay attention to that. When there are 4,000 people died from the what you call terrorist activities, we really become panicky and we have whole departments created, Homeland Security. And this coronavirus, 200,000 people dies, not big deal about it. It's a thinking process. We need to think
yeah,
about it.
something a little crazy in the brain to not
Right.
understand
Not
how dangerous
understanding.
this is.
And as a primary care physician, when I talk to my patients, I find all kind of different informations and answers and logic,
Mm,
why to treat or not to treat.
mm.
Sorry. So this is serious disease, but somehow or other we do not really understand that. Sorry, it was phone call.
Now I have heard that the CDC, the Centers for Disease Control in the United States, has put out a directive. This is approximately last month. That there is a certain amount of evidence that approximately 1/3 of the people that catch coronavirus will have long-term effects from
Yes,
it.
you
Tell
are
us a bit
100% right.
about these long-term effects.
So before going to that, I think the most important is risk factors, and the higher the age group and underlying medical conditions,
Okay.
these people going to have highest mortality.
Mm,
So there are 40% people populations, they have coronavirus, but they don't have symptoms. And these
mm,
are the most dangerous people. These are the
mm,
people who are spreading to the more people because they
mm.
have no symptoms. They feel I'm fine, and then you give it to many. So now this disease is not
So
from.
no, so just to be clear, no symptoms yet they are contagious and they are spreading the disease.
Yes, and that's the problem. And we need to screen as much as possible. So suppose let's say I don't have any symptoms, and if I have some contact with the person that has little bit infectious nature or highly infectious situations, I should be tested even though I don't have symptoms. Then I can
Mm,
prevent to my family or my friends. So that's, I think government has to do something more, and I think people should also educated more about it. So
mm.
because asymptomatic carrier are the highest problem right now, biggest problem.
So, does this business of recommending masks and social distancing and having some level of isolation, depending on how old you are, etc., are all of these advices, are they good advice to follow?
It's a fundamental advice actually. If you cannot do anything else, that's fine. The 3 or 4 common things that everyone should follow and do. Number one is frequent hand washing. That's the biggest one, the cheapest and biggest. Water is free, and if you don't have water, alcohol, 60-70% alcohol should use to wash the hands. So frequent washing is important, and mask must be there.
Mm,
Not like some people use it or not, especially closed spaces,
mm,
temples. Basically, we are talking about for our devotees community, the temple, churches. I think those people they must have that mask mandatory. And even if you go outside, very good. You are alone in your by yourself.
I'm ready at any moment.
So this is nice. Well, what leaders does, the common man follows, right? According to our Bhagavad Gita.
Of course, I am not a leader. I'm just a servant.
We are servant. We are not leader, of course. But at least anybody has some little positions. I think they should give the leadership and give the role model. So yes, the washing the hands, using the mask, covering the nose and mouth both, and then safe distance. That's three the fundamental things to do.
Let me just show you one other thing. You can maybe make a comment, because I see this in pictures and devotees all the time. They're wearing the mask, but this is how they're wearing it.
Yes, you
I
can
see this all the time in kirtans and whatnot. Is this not crazy?
It's very crazy. No doubt about it. It's very crazy. And in our local Baltimore temple, we are watchdog. We always, when kirtan's going on, we just look around. Who does not have mask properly on the nose? And we tell them, Prabhu, you must use the cover your nose too. Then people are singing, giving class, the drops, and we remind them. So we follow in our Baltimore temple, at least I know that. And we are strict about that. But distancing is still a little, we have to work on that. We have good, safe 6 feet distance.
But then let us go back to this long-term effect, because we're seeing this, we're hearing about this. 2 weeks ago, we had an interview with a lady in Alachua temple. Her name is Ganga, and she is in her 180th day of suffering from the effects of the COVID that she got. Her hands aren't working quite right. She still can't breathe. So it seems like a certain high percentage of people have long-term effects. Yes?
Yes, because it's a multi-system disease now. It's a disease now. It affects not only lungs, it affects your immune system completely. That destroys your lungs, the heart. It has effect of myocarditis. Is infections lead into the muscles of the heart. Inflammation start there. This whole inflammatory process going on. And so it affects the heart, it affects the kidneys, affects the immune system, all body parts. That's why complicated persons die so quickly, because of multi-organ failures. This system just cascade reaction starts. And that's why this is a so long-term effect. Actually, normally the average what you call period is about 3 months to get better from the cough and shortness of breath. Average, not complicated patient. If you complicated case, it takes longer period. So this disease is a very serious disease. We cannot.
And then I understand that it actually can even transport into the brain, and then you end up with neurological problems.
Yes, it is also in pediatrics too now. It's called inflammatory disease now. So pediatrics group is there, and elderly people has the problem. Pregnancy is a problem. So I think it's affect across the board, and we do not have more information yet. In next year, 2 years, 3 years, there will be more and more information coming how to manage this coronavirus. So yes, it is a serious disease, I think, and our community temple devotee groups and general public too. I think we believe in Krishna. We have strong faith. But yesterday, I think I was watching the video from that your interview with Badrinath, Badrinath Maharaj, and he mentioned that Prabhupada said that devotees are fearless and should be, but not full. So I remember that sentence now. That
Right.
yes, we should not be acting as a fool. We should have strong faith in our sadhana, we strong faith in Prabhupada, strong faith in Krishna. But medical science is available, we should utilize properly.
So in the devotional community, we have learned that the material world is not for us.
Yes.
And we want to get out and we want to return to the spiritual world. And so we have developed a natural distrust, if you will, for the material world. But The other side of our philosophy is that we are supposed to be utilizing everything in Krishna's service.
Yes.
And so many devotees, they have like a fundamental distrust of medical science. Why is that?
I think because first of all, if I look back, how your culturally you're developed, how is your understanding about medical science in India, especially people have different kind of understanding, whether spiritually or even materially or scientifically. This is a vast country and this is a different culture. Every state you go from one state to next, there's a whole different ball game. So everyone has their own understanding, whatever they learn from their parents and culturally what they learn. So they have their own belief, and it's difficult to remove the belief from the people's mind once they have stuck to that. I think this is human psychology. So, so some people, I have some devotees in USA, and if they have like a sprained the ankle or fracture, and they wants to do Ayurvedic medications, and I said, you are suffering. You're giving unnecessary torturing to your body. You need to take some ibuprofen or something for a few days. No, I don't believe in taking medications. And they're young, intelligent people. So those people, some people try to use the oils. When my Guru Maharaj was sick a little bit, and then their suggestions came to start oil. And I says, no, you can do oil after he gets back to the temple, not before that. So we had a good team of doctors, and we made a strong decision that yes, right now focus on allopathic medications, and we continue our prayers. We keep our strong faith, and both works. And ultimately, we believe that Krishna is final controller, but Krishna also tells us that you do your duty responsibly. So medical science is there. I give example of my Guru Maharaj. He is a very intelligent person, and he does not ignore his health at all.
Yes,
Even
he has many doctors that help him.
Even minor problem, he does not ignore it. And he takes some Ayurvedic medications, but he takes allopathic also. He does not ignore that. So I think we should, in this modern technology and science is there, we should utilize everything what is available in the service of Lord Krishna. I think that's the way I personally take it.
So when we look at the devotees, I don't know if this is true, but it seems like they suffer from some of the common diseases that affect many people, such as high blood pressure or diabetes, and they're hesitant to take medicines. Doesn't that actually put their lives in danger?
Yeah, I think my understanding about this is human nature for generally, whether devotees or non-devotees. We do not believe in taking medications. That's number one. Not believe in going to the doctors. We don't want to find out something wrong with me. We all, this nature, we don't know, even physicians and medical professional people, they also ignoring the certain situations. They don't want to do it. They preach, but they don't want to do it. So this is human nature. So we accept that one. So our goal should be, we should educate them. More education comes, people will understand. So education should be there somehow or other. We have to give across. So physician's job is to educate the patients or their dependents. So I think if we can educate more and more people, I give example that as we said, coronavirus affects the most common people are obese and people who are hypertension, diabetes, high blood cholesterol, COPD, smokers. All these people, they have what you call a high risk. So corona comes and goes, and corona kills 200,000 people in USA and worldwide, many more. What about this hypertension and diabetes and cholesterol? They're also killing number of patients, but we don't pay attention to that. So this is now time to educate more people that, okay, corona is there. Let's also go underlying these conditions also and fix it. And if you believe me or not, to get simple blood test or going to doctors maybe once a year or every 2 years, it does not cost maybe $100, $200 at the most per year, and anybody can afford. Now, suppose somebody has financial problem, then that's where I'm talking about devotees' concerns. I think we should have some physicians group. They can help the Vaishnavas. When I started my practice, in the first 5 years, I was seeing a lot of patients who has no insurance. And you go to the hospital in the middle of night, take care of the patient, and you get zero money. This is my what called mandatory my donations. So I thought, well, if I can do the same service to my devotee friends, and I can do free service, they can at least don't have the insurance, nothing to worry about it, then this can be done. So in the ISKCON, we can have something like that. We have so many resources in our community. There are physicians, nurses, therapists, cardiologists, so many different specialist people we have. If everybody can help to the devotees, they also get benefit by serving the Vaishnava. They get connected to ISKCON and Prabhupada. Their life can change. If they're eating meat or they're smoking cigarette or drinking alcohol, they will stop it. So you can community members, you can make devotees also. And the
Yes.
devotees will help the devotees too.
Yes. So when we spoke earlier this week about this issue, and I brought this idea up, you very much liked it. And I have to say, Prabhu, we have already begun working on this. I have deployed my daughter, who is very knowledgeable about the internet, and we are in the process of now beginning a website that will end up being a physician referral website for all the devotees. We have many things to do to be able to do that. We obviously have to have proper referrals coming for any doctor that would be part of that site. But this whole approach that you and I were talking about, I want you to know we have begun to act on this at this time.
I think this is excellent suggestion, excellent program. I think if you can do it, actually, this is in my heart. I was thinking that yes, we have so many physicians, nurses, paramedics, people, cardiologists, all kind of specialist people, and I think every local temple can start first and get the information about the local professional people and utilize them, make a little small group, and those devotees living in the temple or even outside, and if they don't have any health insurance or they have any financial problem, they can approach, and the devotee will actually physicians will love to serve those devotees.
Yes.
When the devotees come to my office, I feel so great about it. Actually, when sannyasi comes or some advanced devotee comes, not only that I take care of them, I give donation on the top of that. So it's a benefiting to me.
Yes.
This is another part of Vaishnav Seva we can call.
So you then would be willing to join our team as we begin to form this physicians referral system. Yeah.
I will be very happy to support this.
Okay.
This is nice noble cause for me. This is my goal. This I want to do it.
Okay. Great. Great. I'd want to just go back to that annual blood test.
Yes.
Because so many of the common diseases can be found simply through that blood test. The diabetes, the cholesterol, tell us the importance of just having that regular checkup.
At least once a year after 40 years of age. When you are 25, 30, no problem, you can run around. But when you cross 40, I think then we should, because most of the medical science, the preventive care task force suggesting after 40 everything starts.
Mm.
And this is true, statistically is true. So after 40 starts, let at least get at least once a year physical checkup. And there's nothing much to check. At least simply blood test you can check and some blood pressure you can check. That's more than enough.
And the diabetes disease, which is long-term terrible thing, the hypertension, these can be easily controlled through common medicines, can they not?
Yes, actually, I was just going to some statistics just for the curiosity if somebody knows to. Obesity, I was have some data. The overweight is common. Everybody has overweight. Nobody's underweight now, at least in America. But in America, 42% populations, they are obese. It costs $150 billion cost for those. Statistic money-wise. Diabetes, there are 34 million diabetic people right now in USA. And the 88 million people are pre-diabetes. They have no clue about that they have diabetes. So pre-diabetes is there, and 95% people, they have type 2 diabetes in America. So it's a very common problem. And obesity leads to diabetes, cancer, cholesterol, high blood pressure. Everything is related to the obesity. Now, our temple devotees also. When Prabhupada started a movement, the morning program give you enough exercise that you don't need anything else. That's actually now dying out. Practically, even Kirtan, I saw Kirtan leaders, they use the harmonium more. There's no kartal going on. The whole thing is changing. Mahaprasad is there to eat. And there's not many. So devotee will eat Mahaprasad. Well, we love Mahaprasad. But then we have to think about cholesterol, diabetes, blood pressure, and then no checkup. These are the devotees who are really spent 25, 30 years in the movement, and they prematurely die.
Yes.
We can say, well, it's Krishna's mercy, Krishna's plan. Yes, it is Krishna's plan. No question about it. But what is our plan? We have to have some plan. So that's why I think this important things to check once a year. In my office, if somebody comes for the cholesterol and thyroid and prostate, simple things to check, does not cost more than $100 at the most. Once a year. And if it's normal, you don't worry about 2-3 years, but you can continue. So bottom line is that if you can do good diet and good exercise, then most of the conditions are not even to worry about it. So that's why I personally believe that preventive care is the best things to do than really treatment.
Yes.
That applies to COVID, that applies to common diseases, and ultimately, of course, we believe that Krishna is final controller. So we should not question about that. But at the same time, we should utilize, as Prabhupada has quoted and Badrinath Maharaj mentioned, that yes, we should be fearless but not full.
Okay, so this has been a wonderful interview. I think our takeaways are that, first of all, you're advising us COVID is serious.
Yes.
Second, the simple things that should be done: wearing the mask, washing the hands, keeping the distance. These are just things that really must be done.
Must be.
The third point was that we should not be like afraid of medical science. Medical science is good as a general statement because it can cure many common diseases, and that we should have regular checkups. And of course, we should be living a healthier life of exercise and proper diet.
Yes.
Lastly, you and we're going to work together and develop a physician referral system for the entire movement.
Yes.
And we're going to start working on that this next week.
Yeah, we start with the ones small steps. It will widespread go to globally.
Right.
And that way we can really serve the Vaishnava.
Very good. Well, we're very, very happy that you've taken your valuable time to help out all the devotees of the world. Very, very much appreciated. And I thank you so much. And I'm really happy to have this initial friendship with you. And once we start serving together, I'm sure that we will become the best of friends.
Yes, and thank you very much again for allowing me to participate.
Hare Krishna.
And thank you to all the Vaishnavas. And Vancha Kalpatarupisya Kripa Sindhu Chitanam Pavanebhyo Vaishnavya. Thank you very much. Srila Prabhupada ki jai.
Hare Krishna. Glories to Srila Prabhupada. Thank you, Prabhupada.
Thank you, Gopal Bhatta Prabhu.